My dear students, welcome to the workshop on Migraine Diagnosis. Medical history is the mainstay. Let us discuss on Migraine Diagnostic criteria, Migraine Diagnostic aids, role of neuroimaging in migraine, diagnostic criteria, migraine without aura, at least 5 attacks that fulfill criteria 1 to 4. Migraine with aura. At least 2 attacks that fulfill criteria 1 and 2. Chronic migraine headache that lasts more than 15 days in a month for more than 3 months that fulfills criteria 1 and 2. Medication overuse. Diagnostic aids, headache diary. Headache calendar. Three-item identity migraine questionnaire. Migraine screen questionnaire. Role of neuroimaging. For confirmation.
To mitigate migraine headache, stay tuned with us. Let's know more about it from Dr. Migramin.
Calm touch for mind and soul.